Hi, my name is Nate Miller. I'm a student physical therapist, and this is the technique to assess for radiocarpal joint mobility. So I have a model here to help me demonstrate before I work on a person. And just background on the radiocarpal joint, it's an ellipsoid diarthrodial joint, and it's made up of the radius here, the distal radius, the scaphoid lunate, and the tricretium. And so for joint mobility, we're just going to assess the end feels of the different motions. There are 5 different motions we're going to be assessing. We're going to do distraction, and then we're going to do the 4 different movements at the joint. So for flexion, for extension, ulnar, and radial deviation. It's important to note that when you're assessing joint mobility, you want to start slowly in case the patient has pain, and then from there you can push harder if there's no pain in order to assess the mobility. Also make sure that you assess both sides. So you want to test the impaired side and the contralateral side, but start with the non-impaired side. So for the stabilizing hand, it's the same for all 5 movements. You want to stabilize with the web space of your hand on the ulnar and the radial styloid, grasping there. And then the treatment hand is going to grasp with the web of the hand on the proximal and distal rows of carpal bones, just like that. And you want to make sure that when you're performing these techniques that you get as close to the joint space as possible. So you want to palpate the joint space first and get in there so there's not much space. That'll just give you a better mobilization and feel for the joint mobility. So just for traction, you want to stabilize as we talked about, and then you want to pull in a longitudinal way, gently at first, and then the restriction you should feel here for end feel is tissue resistance, so it should be a firm end feel. For a volar glide, we're going to be pushing towards the palm of the hand. Stabilization and treatment hand are in the same position, but you just want to push down gently towards the palm, and this is to assess for extension at the wrist. For the dorsal glide, you can do this the same position, same therapist position. You're just going to be pulling upwards towards the back of the hand. And this is to assess for flexion at the radiocarpal joint. For ulnar and radial deviation, the patient's going to put their wrist in a neutral position, and stabilizing hand, treatment hand are in the same position. For an ulnar glide or an ulnar assessment, you're going to push down towards the ulna, and that's to assess the radiocarpal joint for radial deviation. And then for a radial glide, you're going to pull up towards the radius, and that's to assess the radiocarpal joint for ulnar deviation. So when I have a patient, Becky, you're just going to have the patient seated in a relaxed position, coming to the side, resting the hand off the side of the table. So I'm going to lift the table up a little bit so that I'm at a good position to treat, and then I'm going to grasp the patient's. First, I'll explain to the patient. I'm just going to assess your wrist joint for normal movements, just to make sure there's no restrictions in the joint. So it's going to feel like a gentle pulling in several different directions. I'll tell you before I pull. Just let me know if there's any pain, okay?
Okay.
All right, so the stabilizing hand uses the web space to grasp around the radius and the ulnar styloid, and then the treatment hand around the distal and the proximal carpal bones. And then we're palpating the joint space just to make sure we can get as close as possible. For distraction, you're just going to say you're going to feel a gentle pull as I we're going to be moving the radius from the carpal bones. So a gentle longitudinal pull. And it's just gentle at first. If there's no pain with that, then we can pull a little harder to assess the end feel, and it is a firm end feel for tissue resistance. For a volar glide, hand positions are the same. The patient doesn't have to move. I'm just providing distraction at first, and then pushing straight down towards the palm of the hand. Any pain with that?
Yeah.
No pain, so I can push further to assess the end feel. It's again firm because of tissue resistance. Once you're done with that, you can do a dorsal glide to assess the motion there. So I'm just going to distract a little bit at first again and pull straight up towards the back of her hand. No pain with that?
No.
Good. So I pull up to the end. The end feel is again tissue resistance, so it is a firm end feel. so that I can have the patient neutral arm. And then same stabilization, same treatment hand position. And we're going to assess first for the ulnar side for radial deviation. And we're going to provide a slight traction at first and then push straight down to the ulna. Any pain with that? No pain, so I can push a little harder. And that is a hard end feel with a bony restriction. And then the opposite, coming up to the radial side, provide traction, pull straight up towards the radius. Any pain with that? No pain, so I can push further. And again, it's a hard end feel with a bony restriction.